No, they have nothing to do with insulin. The way I describe it is that they give the cat's own insulin a platform to work.
Welcome to the Purr Podcast, your favorite feline-focused podcast, where we dive into all things feline, medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Jolle Kirpensteijn, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started. We are in Las Vegas at the Western Veterinary Conference, and we're talking to Dr. Renee Rucinsky, who is a board-certified feline specialist. And we left off, Renee,
with a cliffhanger.
The last episode, because new diabetes guidelines are coming in.
For cats and dogs.
Yes, for cats and dogs. And I am not at liberty to talk about all the details and the guidelines.
We get
but I am, I know.
No, we get that. It's the way they are.
Yeah, you know how AHA is. They'll come after me. No, just kidding. AHA is great. But yeah, I am more than happy to talk about one of my absolute favorite diseases.
How do you feel about having combined guidelines for the two species versus separating them? Do you have a position on that?
Ooh.
I do have a position on that, and they will be separated. Mm-hmm. They are separated.
I think. Don't you think
for
it's
the
about
new ones?
The new ones are separated.
It's about time, isn't it?
I do think it's about time, and there's so much information. That one giant document can be a little bit overwhelming.
Well,
it makes it easier, if somebody wants to go look up cat things versus other things, then it's easier to find. And the whole point is to make managing these complex diseases easier for people. So however we can do that.
Yeah. I remember I don't know if you'll remember better than me, but within the last year, some nutrition guidelines that were specific to a certain disease, and it wasn't diabetes. I can't remember what it was, but anyway. So I looked at it because I do like internal education for our team, and it was something like a 40-some-odd page document. And I thought, I can't just say to our vets, "Here, read it."
Yeah, it's a lot. It's a lot. So yeah, I don't. Everything has been lumped together in general textbooks and all of that stuff for so long, and it's traditional to put the canine stuff first, and I think that it's dismissive and perpetuates the second-class citizen kind of stuff, and so I'm happy that these are separated, and it's even for people who are not in feline only practice. You don't, if you're trying to find some information on something, you don't want to go on it necessarily a deep dive on everything. So, I don't think there's anything wrong with separating the two species out when it comes to that.
No, and I think it also allows you to it gives you a bit more room and a bit more leeway to pull out key things. Like veterinarians often, or at least I do anyway. I often go to guidelines because I have a specific question I want to answer, right? And it might be a fairly common thing too. So the more flexibility you have, you can have some of those called out in boxes or tables or whatever, right?
Yeah, without a doubt.
Yeah.
And when you're talking about something as specific as diabetes, that diabetes in a dog is a completely different disease than diabetes in a cat. So they really, they have the same name, but it's not the same.
Different disease in so many ways. Yeah. Did you ever have a diabetic canine?
No, I've been lucky.
Yeah, it really changes your view.
No, I understand. And you always talk about it when you do your lectures on your own cats.
Yeah.
How much it changes,
My husband and I are both vets, and it really changed our view of treating diabetic pets, let me tell you, once you have one of your own, right?
Right.
Yeah.
So you're kind of a diabetic guidelines junkie, because it's not the first rodeo.
It's not. No.
What makes us go back over and
guidelines.
over? I'm like that for retroviruses. I don't know why.
Yeah.
Why?
I don't know.
There's there's still so much work to be done.
I think that's it. I think that if I didn't feel like there was new stuff to discuss, and then it wouldn't be as fun. But the fact that we do get to have new things and teach people how to use these new drugs, especially this go round.
I just want to say some things have changed drastically this go around.
Much.
So can you highlight some, without giving too much away of the new guidelines, can you highlight some innovations that have happened in the
since the last
2
one
and 3? Right.
Yeah, I think the biggest thing that we as cat veterinarians are using now are the SGLT2 inhibitors. So it gives us a whole different way to tackle this disease. And when you choose the right patient for it, which isn't that hard to choose the right patient for it, these drugs are infinitely safer than insulin. Yeah. I mean, insulin is no joke. You know, I mean, insulin will kill cats. Right. And, you know, I mean, you watch true crime and, you know, how do these, you know, nurses kill people? They're giving them insulin.
Kill people. Exactly.
Right. So, I mean, there's
good point.
I know those nurses. There's always going to be a place for insulin, right?
Yeah.
But having something that the people don't have to change their lifestyle, they get to preserve the relationship with their pets. Your staff doesn't have to know how insulin works and what the problems are.
And all the different insulins and different syringes.
All the syringes, all the things that these medications are just a complete game changer for treating diabetic cats. And once veterinarians get a level of comfort with and they're not scared of them, I tell people all the time that until proven otherwise, when you diagnose a diabetic cat, you should be thinking SGLT2 inhibitor first.
Yeah.
Are they everywhere available in the world, or is it just here?
No. Canada, Australia, the UK, or European Union. EU.
Yeah. Not in South America.
Not in South America yet.
No. And I don't know about Asia. Well, you may not have been thinking about it.
I feel like yes.
Wouldn't surprise me
Asia.
in Japan in particular, because they're pretty forward thinking.
But I don't know that for sure.
Right.
Yeah.
So
Canada only has one of the drugs too.
Explain a little bit how they work for vets that are not.
They're very actually, despite the diagrams, they work very simply.
They're so simple. The diagrams make it so hard. You guys should come to my lecture and see what I use for a diagram.
Yeah, you don't need a diagram.
You don't. So the way they work is they keep the body from absorbing all the insulin or all the glucose that is presented. So when you have too much glucose in the body, the SGLT2 receptors, their main job is to pick up all those glucose molecules from the nephron and send it back into the bloodstream. They don't look at see what traffic is already there. They're just making the traffic jam more and more. No feedback. So when we use an SGLT2 inhibitor, we kind of block that off ramp, but it's not a complete block. So we send 50 to 60% of the glucose down into the urine, and that allows the blood glucose to normalize, which is all well and good. The problem is, well, there is no problem. That's great. The reason why it wouldn't be a good choice for some cats is that the cats still have to have functioning beta cells in their pancreas. They still need insulin because the high glucose isn't the only problem. The problem is the movement of the glucose into the cell, and you have to have insulin for that. So that's where things get a little twitchy, because we don't have a good way to know if the cat is still making his own insulin. Right. So,
yeah, we know the general characteristics of cats who are probably still have enough of their own insulin.
Exactly.
Hence the screening criteria. So I think a good way to think of it is that these new drugs have nothing to do with insulin.
They have they have nothing to do with insulin. The way I describe it is that they give the cat's own insulin a platform to work. Because you think about it as like being in a big multi-doctor practice.
Right.
And, say it's 5 doctors and 4 go on vacation or on leave or whatever at the same time. But the front desk doesn't get the memo. So they're still booking 5 doctors worth of appointments and there's 1 doctor there.
Right.
And for a while, she's doing a great job.
Yeah.
She's like one of those ducks that's going upstream and like but she's cool, right?
Yeah.
She's doing all the stuff.
Yeah.
But eventually it begins to be too much. And when you get a relief vet in, when somebody comes back from vacation or sick leave, then the pressure gets taken off. So she's still working. She's working. She just needs some help.
Yeah.
And so, the pancreas and beta cells are that 1 doctor that's left behind. SGLT2s are the relief vets coming in to be like, okay, I will help you out. I will make your workload
Smooth up
better.
the traffic.
Oh, nice.
Yeah.
I like that.
But with no vet there, say everybody leaves at once, then it's going to be a problem.
Failure.
That's when your ketones build up. Don't have that one person still working their butts off.
I love that
So-
comparison. That's
It's a great
awesome.
analogy. I'm
Right.
so going to steal it.
Yes, that is.
As long as you give me credit.
I will.
This is
Yeah.
such.
I mean,
it's
it makes it so much easier to understand.
Right.
As long as you have somebody in the building that's still working, then you have room to move.
Yeah.
And how do you make that difference then?
Well, so I mean, there's a certain way a diabetic cat will look that makes it a better option. The typical middle-aged fat guys are probably going to be good options. Cats that have been really sick for a long time, maybe not the best choice. But I think the scariest population of cats that people try to use these drugs on, and you tell me if I'm wrong, are the old cats. The old cats that are probably not primary diabetic. They're probably chronic pancreatitis or small cell lymphoma or things like that. And you can't predict how those pancreases are going to be functioning. And that's almost a whole different disease.
It is. And we actually just recorded some episodes with Dr. Katie Tolbert from Texas A&M, and we spent a lot of time talking about pancreatitis and how it's like we don't really understand it. It's not the same as pancreatitis in anybody else.
Right.
So I think you're right. And so we especially at this early stage, right? We want to concentrate on brand new diabetics who look like they're unlikely to have any significant problems, right? So for one of the companies that makes these drugs, I'm on their global advisory board, and we wrote that company's like international global diabetes guidelines. And Steen Neeson is on our advisory group. And we came up with happy diabetic versus unhappy diabetic, right?
Yep.
We thought that was a nice, because you know yourself, all vets will know, you get some cats that come in and just by what's written on your appointment book, right? You're like probably diabetic, right? And they come in and you confirm they're diabetic, and the cat probably doesn't even really recognize yet that he's not. Do you know what I mean?
Correct. Yeah.
They are otherwise happy.
Yeah.
Like, right?
Yeah.
That's your guy. However, when that language came into some countries, and the US is one, some regulators didn't. They happy's not scientific enough. It's not quantifiable. But to me, it's a great way of thinking.
So you have a happy doctor. The one doctor is still happy, you use it for.
Yes.
The one that is really unhappy in the corner crying probably shouldn't use it.
Well, you have to gauge how close to the edge she is.
Right.
Well, and we have to recognize that you can't get it right every time. Hence the more intensive testing at the front end, right?
Right.
Yeah.
Right. But you're gonna know usually within the first couple of weeks if you've made a bad choice or not.
I think within the first week or two you're gonna know. Right.
Absolutely. I think I think within 5 to 7 days mostly. But
you've got a suspicion.
I think until people are really comfortable with things, I recommend that they wait that full 2 weeks and really monitor those ketones.
So wouldn't you be afraid that this is one of those drugs that people will immediately grab without even thinking about it? So you have a diabetic cat, put it on there.
Not just yet. I think the level of fear. Tell me if you get the same vibe I do. I think there's still veterinarians are inherently conservative, I still think, right?
Mm-hmm.
And so this is so new. It's new, and it's a new class, not just new in its class. I still think there's a lot of like reticence and conservatism about trying new things. I don't think we're at that, but I think we may get to that stage, Jolle.
Yeah.
Is that, do you get the same feedback?
Yeah, I mean, insulin is the devil we know, right?
Yeah,
so
yeah, it's more deadly, but at least we know.
But at least we know, right?
True,
and I think that when the drugs first came out, the warnings were a lot. Yeah. I remember when the first company asked me to come and be in this small group of opinion people, and I was like, hell no. I'm never putting my cats on any of this. You got to be kidding me. And then, over time and learning how it works, and like, oh, wow, this is cool. But I mean, I had that luxury to do that. And I think when you have veterinarians who have a drug rep come in for 10 minutes and talk about it and talk about, the diabetic ketoacidosis, and it's how the blood glucose is normal for that. And that's all people remember when the incidence of that is super low. And so it's just people getting comfortable with it. I'm okay with them reaching for it first, but they just have to look at the cat and not just look at numbers.
And we're going to learn a lot more, I think, in the coming years.
Yeah, and I think that those real hard parameters that people put on will officially soften.
Yeah,
I mean, it's harder. We're already softening them
as we learn.
Yeah. How important are then the other things that we used to do with diabetic cats, like nutrition? Is that still?
I mean, nutrition's always important, but I mean, one of the good things about the SGLT2 inhibitors is as we change those factors that created insulin resistance in the first place, like the obesity, like potentially the steroid requirement or environmental things, like this cat is just a bump and has no environmental enrichment. If we can change those things while they're on an SGLT2 inhibitor, it's going to be a whole lot safer than when we do it with insulin, because you do it with insulin, and how a cat has gone into remission is that their blood glucose bottoms out and they have a hypoglycemic crisis.
Yeah, exactly. Yeah, they have to approach death, and
that's how to know. And that's right. And literally. And with SGLT2 inhibitors, you have this luxury of doing the work and not worrying about coming home to a dead cat.
Yeah.
And so if you've mitigated all those other factors, then you can take them off the medication, see what happens. Yeah. Sometimes they've gone into remission, not because of the drug, but
in a way.
I mean, in a way,
the drug gave them the platform or the opportunity.
Yeah, exactly.
I just, as being a devil's advocate here, I just worry about the fact that people will say, I don't have to worry about the other stuff anymore. I'm just going to put them on the drug.
What do you mean about the other stuff?
So if you don't deal with the environmental things that you should be dealing with, because now you have kind of a solution. Yeah. And I love vets, I love veterinary medicine, but we're also often really lazy in the things that we do. Yeah. Look at the long-acting antibiotics that we tend to use and don't even think about what the side effects are going, and it kind of prevents us from this critical thinking about the fact that, yes, the cat needs to lose weight and we need to change all these things. And
he still needs to lose weight, because the weight is important for other things too, Yeah.
Well, it's interesting. I've had clients that we try to take off, or that we will take off the drug. And I've had other clients where we have improved the cat's body condition. We have improved all the other stuff. And I'm like, okay, well, we can take them off. And they're like, yeah, I don't want to. I really don't want to.
There's nothing wrong with that.
And there's nothing wrong with that, especially since if we're talking about the whole cat and how, probably close to 50% of cats have some degree of hypertrophic cardiomyopathy as they get older, and, kidney disease and all that. And these drugs, more and more research is being done to show that they may be very helpful with cats with cardiomyopathies and potentially kidney stuff. And so I think that we're going to learn over time that there are going to be other uses for these drugs.
Hopefully.
Yeah.
It's a big hope.
Yeah. Wouldn't that be cool?
Yeah, it's true in people. And so we certainly have the hope and the interest in finding out.
Yeah.
Wouldn't that be cool?
Yeah,
right?
It'd be great.
Yeah. And I get it when clients don't want to stop the drug because everything is normal now. Like, why would you want to?
Don't rock the boat, right? If it ain't
now,
broke.
sometimes, of course, it's financial
Sure.
and whatnot. And like, I think the bottom line is we can support them either way, right? Like
Right.
if you want to try taking them off, fine. If you want to keep them on, fine. Did you ever think we would get an oral drug for diabetes in cats? I still pinch myself.
No.
So,
and it's so easy. I mean, I joke around like from all the levels. Like, you know, I've been the diabetes chick for forever, right? And like, it's so boring now. I hate to say that.
Boring.
Well,
it's so boring. I mean, it's not.
Listen
And we still have
her.
insulin, but like when you have the perfect SGLT2 inhibitor cat, it's like I am useless. But it's fine. But yeah, the fact that we have both liquid and a tablet that's palatable.
So
amazing.
Years ago, one of the companies approached me and asked if my clinics would be wanted to be on stumbling over everything, part of their clinical trials.
Mm-hmm.
And I said, no, like no oral drug works.
Why am I going to waste my time?
Yeah, I'm like, and they kept explaining and were persistent, and finally I gave it. I'm so glad I did, but I had that.
Yeah, come on, give me a break. We don't need another glipizide. Like, right? Like, give me a break.
All of the drugs in people, the traditional drugs, all fail in cats, except this class.
So what do you do with a cat that doesn't want to be pilled or orally medicated?
There's a liquid.
Yeah, but I mean,
well, both of these products are meant to be mixed in food.
Right.
Refusal is rare, I have to tell you. Refusal is
very, very rare.
And that in and of itself is another shocking
huge
thought. Yeah, refusal is rare. The other thing I like about this like new avenue of treatment is that it allows us to embrace this like spectrum of care idea.
Without a doubt.
Right. I think you always could, even with insulin, especially with the monitoring protocols.
Yep.
You and I have been a vet long enough when we just like looked at the cat, are you happy or not?
Yes.
Guess where we are.
Right. Are you happy or not? Right. Yes.
So you always could, but it broadens it, don't you think?
Yes, absolutely. I mean, I guess when you're looking at spectrum of care from a like how distressed is the cat, for visits and all of that sort of stuff, I think that it's a huge benefit for that. When we're talking about spectrum of care from a financial aspect, maybe a little less so.
Maybe.
Are the drugs expensive?
Well,
kind of. I mean, they're affordable when you look at the big picture because you're not having the complications. You're not having
blood glucose curves.
Which, don't say.
We're sisters.
Yeah. I haven't done a blood glucose curve in over a decade. I mean, unless I'm in a drug trial that requires them, and then I argue with them about that. But no, I do not do blood glucose curves.
But it is standard of care-ish.
You have not read the guidelines.
Maybe not the guidelines.
It's
very common.
It's very, very common.
It's very common.
I'm going to send her a copy of it.
Yeah.
No, I'm with you. But it's another one of those things that's hard to break veterinarians from doing.
Oh my gosh, it hurts sometimes.
Yeah, but if you think of that, so I think of it kind of like my model has been hyperthyroidism. If radioiodine is front loaded on the cost, right?
Mm-hmm.
But if you average the cost out, drugs, monitoring,
of course.
Without
right?
doubt.
And I think the SGLT2 inhibitors could be, I haven't costed it out, but my guess is it's not. For some cats, it's going to be cheaper than insulin because some cats are very hard.
But I think it should be costed
especially,
out.
Pardon?
It should be costed out. I mean, people should know what the
Yeah.
benefits and
It's
risks are.
pretty variable because some, like we've all seen cats. I'll never forget this client who called up once for a refill on insulin, and I pulled up the file. We hadn't seen the cat in like a year and a half. And I'm like, have you been going to another veterinarian? And they're like, no, we just ran out of insulin. And so like this cat's been motoring along just fine, like no curves, no nothing. And you do see other ones that do take a bit more finesse. And I have to say, I think blood glucose curves are responsible for a lot of the problems. But that is kind of status quo right now, that there's a lot of cats that people spend a lot of money on. And I think a lot of it's because of blood glucose curves. So it depends, Jolle, right? If they're easy or hard, or what the veterinarian's approach is. So I think that's kind of what stopped me from trying to cost it out. But
well, and I think, when you spoke of spectrum of care too, I think that even though it is, potentially per dose, it's maybe a $1 a dose, maybe give or take, depending on how you're pricing it. I try to make it, I personally price it a little bit under market rate, but just because I want people to use it. But it's also spectrum of care from the owner's perspective. It really reduces the amount of stress. Yeah, quality of life just from once a day dosing and no fear of hypoglycemia, but also the stress and the technicality of insulin and all of that sort of stuff. We've eliminated that.
We have to teach somebody to do
right. And we've allowed them, when we put them on insulin and it's a fat cat or whatever, we are like, we need to get the weight off this cat. And they're feeling that pressure. And then when we use the SGLT2 inhibitor, like, look, we are gonna level this out. Now, this is your more reasonable time frame to achieve these goals.
Yeah.
And
like this problem is now under control. Some of these guys are euglycemic by day 3. Yeah. It's crazy. And you can now say, look, diabetes is under control.
In 3 days versus 2 months or 3 months.
Let's just work on weight now. It's almost like you can.
That makes a lot of sense.
Yeah. We're going to take this out of the equation.
I just want to talk about chronic stress.
Yes, you did. Yes.
Oh, right. And we were talking about my chronic stress. Yes.
No, but you don't have chronic stress anymore because all your diabetes patients become boring. So
I know. I mean, my life is so easy.
Right.
I can hardly stand it.
They never bite you anymore. Yeah. You don't have to, you do have to build it now. So, but the liquid, you just put it on the food? Is that what you're doing?
And the pill, the tablet is a beef flavored tablet. It's meant to be crumbled in the food.
Yeah.
Okay.
You can give it directly if that sparks joy for you.
And the cats are not selectively.
Refusal is very uncommon.
Yeah.
Okay, talk chronic stress for me in cats.
Why is it important?
You think it is an issue?
Sure.
I do. I think the stressors are different.
Mm-hmm.
I mean, they don't have jobs. So, we take that out of there.
Don't you think they're stressed because they don't have jobs?
I kind of do.
Yeah,
I think that
yes.
I actually don't know your philosophy on this, but I really think that if cats have a safe opportunity to go outside, that they should. Right. Not everybody has that.
Right.
And I worry about birds and things and all of that, but having environmental enrichment, whether it's in the house or external of the house, really reduces that stress. And when we have a cat that has chronic distress from inactivity and boredom and all of that stuff.
Too many cats in the house.
Yeah, too many cats in the house, or too many people in the house, or a kid in the house. I mean, sometimes a cat needs a divorce from the house, and that's okay. Yeah. But all of those things can contribute to poor quality of life and obesity, and then we get cystitis problems, we get intestinal problems, we get mental problems, we get diabetes, we get all of that stuff. It's all intertwined, just like us.
Yeah.
Yeah, I would say that with what I always say with the canine, a lot of things go always back to the microbiome as being a reason why everything is derailed. In cats, I think it's stress that derails things.
Yeah, just life balance.
Sure.
Most of those diseases what we deal with in cats are chronic, and they're probably the basis of that is still that chronicity is probably the stress that they're
I mean, it at minimum, it exacerbates it.
Yeah, that's what I would say. Yeah. So as far as outdoor cats goes, the pictures of cats on the covers of my books, they're in an outdoor setting deliberately. Yeah, they're in an outdoor setting.
It's a big deal.
Yeah, it's a big deal.
You know, we think we're doing them a favor.
You do. Absolutely.
We think we're doing them a favor.
Rescued from the street.
Oh my gosh. One of my biggest,
that's another
we have a local rescue person that brings feral cats and makes them live inside.
Yeah.
And I'm like, oh, these poor cats.
Yeah. So cats are less domesticated, or less many cats are less closer to domestication, I think, than canines are. And asking them to make the great leap in a day.
Yes.
Literally, right? From I'm living outdoors, I'm doing my thing, I'm taking care of myself, you know, I'm guarding my territory, I'm raising my kids, right? And now you're going to make them make the great leap to fully domesticated in a day.
That would make me pee on something.
It's unreasonable.
Yeah.
And you know, it's very, it is a scenario that's fraught with difficulties. The conversation's fraught with difficulties because it depends on where you are. I don't want them to have any disease, and I don't want them to die early.
Right.
So if you're stuck in that arm of the scenario, it can be hard to get people to see that is that a fair trade-off for chronic disease, chronic stress, chronic unhappiness in an inappropriate environment. And sometimes people have a hard time seeing what they've traded life on the street for, right? Would you rather live 5 perfectly happy years, right? Or 10 miserable ones? And some people might say, I'll take the 10. I don't know, but I think a lot of cats would take the 5, frankly.
I mean, some of them are very miserable. And I mean, it's not that I don't prescribe anxiety meds for cats, but sometimes it just takes a little bit of my soul to do it.
And it's rarely enough. I don't think
it's never enough. It's never the only answer.
Never enough. Now you've got a cat who has an extra stressor, because none of the anxiety meds are easy to give. They all have to be pilled. Right. So now you have to pill the cat at least once a day.
Right. More stress.
Make it make sense.
No, I can't.
That's our answer.
I cannot do that.
Yola.
I don't want to go back to diets, but there are some diets that might help there too.
Yeah, and I think it has to be multifactorial. That's a really good point. It
definitely
can't be
use
just
those
drugs,
diets.
Right?
Absolutely use those diets.
Food helps, some supplements help.
It's a multi-pronged thing.
Right. And sometimes the environment is the hardest thing for people to change, honestly.
Without a doubt.
Last question. You probably say we don't need it, but I still want to ask it. Is anybody looking at transdermal application of...
I doubt it.
She's laughing, see? She's laughing.
I have no idea if anybody's looking at that or not. That's very, very interesting. I don't know. There's TBD.
There's so many limitations, though. I mean, look at where we are now.
It's not in the third version. I can find that out already right now. So.
But just look at where we are now and how many transdermal drugs have been tried.
Oh my gosh, you can get anything in transdermal, but it doesn't mean it works.
I mean, we have proof for methimazole.
And mirtazapine.
Oh yeah, mirtazapine.
And maybe amitriptyline.
So maybe,
and that sums it up.
There is too that even though these are there, a lot of vets don't know about them. I still don't understand that. So
don't know
about these transdermal drugs.
That they don't work.
Use them. No, they don't use them. It's still,
I usually feel like the problem's the other way around.
Yeah, exactly. I mean, I think for the most part, I'm okay with people not knowing that there are transdermal drugs.
We're good with that.
That's fine. That's fine.
It's because pharmacies will send, vets flyers with 20, 30 drugs listed and maybe 2 work.
I mean, the molecule has to be so small.
Right.
Lipophilic.
Yeah. No, I understand all that, but even with methimazole, there's still, so you prefer them to pill?
For methimazole? Absolutely.
Yeah, I think the drug levels are more predictable and are steadier, right? Less erratic. Yeah, I've seen, like, some cats do fine on transdermal. I've seen other cats that are like their thyroxine is all over the place.
If at minimum, if people are like really hell bent on doing transdermal for thyroid cats, I at least try to get them to regulate on methimazole, the oral methimazole first, and then we can think about a compounded drug. But for the most part, you're going to have a better initial regulation.
I think so. Quicker too.
But
if you can. I mean, that's what I'm always
if you
saying.
can.
Right.
Yeah, because I mean, we're cat vets. We're always pivoting.
Right.
We're always coming up with some new and crazy thing to do.
Fortunately, the feline methimazole drugs are smallish.
Right.
That's nice.
Yeah.
Like they're not big pills.
Right. Oh, well.
Anyway.
Wonderful discussion. And
Yes.
we're at the end, so we need to finalize this wonderful program.
So when the guidelines, when do they come
when
out?
are they coming out?
When are the new
I
diabetes?
think
roughly?
late summer.
Late summer.
We're so
Okay.
excited.
So in the fall, we'll get you back on. It might have to be like a Zoom thing,
Yes,
but we'll get
Zoom
you.
you in
We'll get you back on to talk about the guidelines.
and
Love it.
spill the
Yeah.
beans
Yeah.
because you could talk about this.
Yes.
stuff.
You did a
Get
really
all
good
the
job,
dirty
though.
secrets.
The dirty
The
secrets.
dirty diabetes
Right.
You
secrets.
did
Yeah.
a good job keeping
Yeah.
it under wraps.
Yeah, that was good.
Fighting the
So-
good fight.
I know.
Good job.
Wonderful. Thank you.
Thank you so much.
This is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.